for someone to come on. This is my first time going live in almost a year. If you can hear the airplanes flying over, they are so loud. Yes, this is my first time coming live in over a year, I think. It's been a long time since I've come live. That's probably why I don't have anybody on my live right now. There's a subject that I want to share with you to bring awareness is HIV and AIDS awareness on December 6th, coming up next Friday. I just received some information about the rise in HIV in black women in Florida. So I wanted to share and I wanted to communicate with my audience. I wanted us to do some true and false questions to see what we know and what we don't know. For those who already know, this will be a refresher. And for some, this will be their first time getting this information. Jesus FDZ. Hi, hello, welcome. Welcome to my live. See if you can get some other people to come in on this live because I want to um, talk about HIV and AIDS. Um, there's some misconceptions, misunderstandings. Some people don't have the definition of what HIV and AIDS is and what it's all about. Main Jijiti, I hope I'm saying that right. Main Jijiti. Hi. Klabed, Klabedche, Klabedge 33KS. You got my 10. You got my 10-piece spicy wing ready. No, I don't. I didn't cook today. I didn't cook today. We're talking about HIV and AIDS today. I do know how to cook spicy chicken wings though. I don't like spicy food that much though. I grew up on spicy food and my body can't take it anymore. I'm a native Jamaican and that's all we ate growing up was a lot of spicy Scotch bonnet food. Jerk chicken, jerk pork, jerk this, jerk that. You say I throw up. Jesus, Jesus said I throw up because of spicy dude. Oh, okay. Unique beauty. Good morning, Queen. Well, it's afternoon now. It's about to be afternoon where I am now. It's still morning a little bit. Grand rising to you. Grand rising to you. I'm trying to get at least 75 to 100 people in this live so that I can share this HIV and AIDS information with you. Good afternoon, Queen. Love you. Thanks for joining, everybody. I appreciate you. See if you can get your friends to join in too so we can talk about this AIDS and HIV. And at the end, I have some true and false questions for you to see what you do know about AIDS and HIV or HIV and AIDS. It's HIV and AIDS Awareness December 6th coming this Friday coming up. I just received some new information about HIV and AIDS and that there is a rise in the cases of black women in Florida. Yes, I just did a video on that. So go back to my channel, Rick McCraw. Hi, hello, how are you? Hi there. Thank you all for joining. Okay, so should I get started or should I wait for more people to come on? You guys got to get more people to come in on the live. I have a over 900 subscribers on this channel. You mean to tell me I can't get at least 100 people to join this live? I know it's been a long time since I've been live, and I decided to just go ahead and come live. So maybe that's why a lot of people don't know that I'm coming live, because they did not have warning of me coming live or a notification that I'm coming live. I might as well just go ahead and go into the subject, because I do have limited time. Um, HIV is the virus that causes AIDS. It damages your immune system, making it easier for you to get sick. HIV is spread during sex, but condoms can help protect you, even though they're not 100%, I must say. HIV stands for Human Immune Deficiency Virus. It's a virus that can only infect humans. Remember that. HIV virus can only infect human beings. Yes. And leads to the weakening of the immune system. The immune system is the body's system for fighting disease. When the immune system is compromised or weakened, a person becomes vulnerable to all kinds of bacteria, viruses, or other agents that causes disease. Right? When HIV is left untreated, it can wreak havoc on a person's human immune system. As this happens, the body is less able to fight off infections. AIDS stands for Acquired Immune Deficiency Syndrome, which means the immune system has been made less effective by HIV. When this happens, a person is considered to have an acquired immune deficiency or AIDS. So, what we have here is that HIV is how it starts, because the immune system was weak, and so the body contracted the HIV, which is the virus. Once the virus gets in the body, it is there forever. But it can be controlled with medication and treatment, right? But if left untreated, it goes into a stage where it mutates into AIDS. That's why they call it full-blown AIDS. Once it gets to the AIDS stage, that's when the person is going to meet their demise soon. I can't say certain words on YouTube, so I have to be, I have to say it in a certain way. But yes, HIV breaks down your immune system, and because your immune system is broken down and compromised, it cannot fight off simple or it cannot fight off germs, disease, or anything. And because it cannot fight that off, the organs in the body starts to break down. And that's when it goes into full-blown AIDS. There have been times in the past where you have heard of a HIV patient or AIDS patient dying of pneumonia. They're only saying that they died of pneumonia instead of saying they died of AIDS, because there was a time when it was taboo to actually say somebody died of AIDS. It was the complications, it was the breaking down of the organs that finally caused the person's death, because it mutated from HIV to AIDS. And the AIDS stage of it of the illness and the virus is where these systems in the body starts to break down. The liver, the kidney, the the lungs. And the lungs is one of the things, the lymphatic system and the lungs is one of the things that seem to break down the quickest. Yeah. So the percentage of African American women getting AIDS is going up in Florida. St. Petersburg is where they're finding that the rates of HIV in black women is going up in Florida. And my question is, why is that happening? Why is it happening to African American women? There are many ways that you can get HIV. You can get HIV through substance abuse, like using dirty needles, sharing needles with someone that already has HIV, and you can transmit it that way by using dirty needles. You can get HIV by actually an accident, working in a healthcare facility or working with a patient, and either the patient attack you with a sharp object or needle that is contaminated, or you stick yourself by accident with a contaminated needle or sharp object. These things happen in the workplace, and that's another way that you can contract HIV. Another way that you can contract HIV is the unborn child. The baby, the fetus, a pregnant mother can trans, transmit the HIV virus from herself to her unborn child. Okay, so and sexual activity is another way to get HIV. So I'm trying to bring awareness um, from my end about what I know. I am a woman. I am a black woman. I am living in the state of Florida. Um, I am in the medical field. I am in nursing. I have patients. And so I've been educated on HIV and AIDS and how to protect myself and how to fight the spread of HIV and AIDS. I've been well educated. I just wanted to share this with my audience. And I'm so surprised that it's only one person right now watching me on this live. And I have over 940 something subscribers. And I only have 2 likes and one person watching this live. I'm not going to blame my subscribers for not coming on at this time, because it was at the last minute. I didn't give a warning that I was coming live, and I haven't been live in almost a year. So, yeah, but I did want to get this information out. I wanted to engage with my audience because I had a few I'm getting tongue-tied. I had a few true and false questions that I wanted to ask my audience to see what we know and what we don't know and how we can educate ourselves. We have to learn about discrimination, shaming others because of their situation. Some people are afraid to come forward and talk about what happened to them. They might feel like they have been in a compromising situation where they might have been exposed to HIV or AIDS, and they are afraid to come forth and talk about it. In my previous video, I did leave information on hotlines that you can call if you do need to talk to somebody. The substance hotline is 1-855 300 3595. That's for substance abuse and substance evaluation if you are using needles. That's a way that you could possibly contract HIV. So there's a hotline for that. There's a PEP line, 1-888-448-4911. This hotline provides expert guidance in managing healthcare workers' exposures to HIV and hepatitis B and C. Okay, I have a I have a phone number for the CDC, the Center for Disease Control. There's a website, www.cdc.gov/info. There's a phone number, 1-800-933-3413. We must be conscious of the fact that this is a sensitive matter and that there are people out here who are afraid to share. And because you are afraid to share, time is going by and you might not be getting the help and the care that you need, as far as if you do have HIV, there are medications. There are people living with HIV their whole life, and have been able to maintain it with medication, and they were able to maintain it with medication so it did not go into the stage of AIDS. And so you can live a longer life. But if you are afraid of the stigma, if you are afraid of being discriminated against and being alienated by your friends and your family or your coworkers, these are the numbers that you can call, the hotline, and you can speak to someone that can help you and educate you, give you the resources that you need going forward. There's another number. These numbers came from the CDC website, the Center for Disease Control website, 1-800-448-0440 or 1-800-HIV 0440. These numbers these hotlines are available 24 hours a day. There's also one for perinatal HIV hotline, and this is for women who are pregnant who suspect that they might have HIV, or they have come in contact with it in some way. If they believe that they have contracted it, or they was with someone and they think that they might have been compromised, their body have been compromised, they can call the hotline. That this is for pregnant women. The number is 1-888-448-8765, and this number is available. This hotline, they are available 24 hours to answer any questions you have, to give you the help that you need, the resources, and send you in the right direction. We have to understand that HIV and AIDS is not just a private, personal thing amongst you as an individual. It becomes a communicable disease because this is something that can spread throughout the community and affect other people. So what they want to do, what the CDC tries to do, is try to test as many people for the HIV virus as possible. Test as many people as possible so that we can get a handle on what is what. When you can figure out who has it and who doesn't, then it's easier to work on what we can do to prevent. uh, we could take precautions. But if everybody is afraid to get tested, if everybody's afraid of discrimination and afraid of the stigma, then that's why many people go untreated and the virus spreads throughout the community and it gets worse. We have to make it comfortable for people to be able to reach out when they need help, if they think that they need help, and that it's okay to be able to reach out and know that someone is going to be there to talk you through your situation, to help you through your situation. This is not just a situation where your physical body is jeopardized. You're also in a state where mentally you are confused, you are sad, you can become depressed because you're thinking of what the effects of this HIV can do to your body and to your life, to you as a person in society. It's not just a virus, it affects everyone, it affects the family, it affects society, you know? You have people, if it's a mother that has it, she has children. If her children's friends find out, uh, if they go to school and people bully them and tease them because their loved one has HIV or AIDS, this thing can affect families in such a dramatic way. It's a chain reaction that can happen. This is a serious matter. Do you know that there are people out here who intentionally infect other people with HIV and AIDS? Yes, they do. hmm Out of vengeance. Because they probably was careless. Some people are being careless and they end up getting HIV, and then they want to be angry and take it out on everybody else, and they decide, if I'm going to pass away with this illness, I'm going to infect as many people as I possibly can. They already feel like they are out of here, so they don't have nothing to lose, so they go around intentionally infecting other people with the HIV. There are laws in different states for that. If you intentionally know that you have HIV or AIDS virus and you go and purposely infect someone else, you can go to jail for that. Yes, you will be charged and you can go to jail for that. They have that as a law now, if you didn't know. Okay? But there are men and women out here who are angry at their situation and they will take it out on everyone else. That's why you have to vet the person that you're dating. Be careful who you have sex with. Use protection, even though protection isn't 100%. Sometimes you might have to do monogamy for a while, just go without sexual activity for a while. Um, yeah, make sure that the person that you're going to be sexual with, you go and get them tested and you test yourself and try to take precautions. That's all I can say. Uh, yeah, yeah. This is not just an individual situation. This affects the whole community. Whole community. You might have a child that's born with HIV or AIDS. They contracted it from their mother when they were in the mother's womb. And now this child has to live with this for the rest of their life because of the mistakes of that mother. Sometimes some of these women are on drugs or on the streets. They using dirty needles, and they are having sexual activity unprotected. Some of these women don't know who got them pregnant, and they have sex with multiple partners during their pregnancy and don't know who gave them the HIV or AIDS, and they're just out here and they're not getting the health care that they need, and it can spread, and we can have a child that's born with HIV and AIDS, along with other drug addictions. Aside from being born with HIV, you also have other um, physical and mental issues because your mom was on substance abuse, on drugs when she was pregnant. There's a lot of things that can happen because of HIV and AIDS. It destroys families, it destroys communities, it destroys friendships, it destroys relationships if we're not careful. Yeah, I just wanted to come and share that. I've been on almost a half an hour now, and at the half an hour mark, I'm going to shut it down and come off of here because um, I don't even have anybody watching me on this live right now. Um, if you do see this live after I'm finished with it, um, click like, click share, click the notification bell so that you can get updates to my videos that are coming in the near future. To all my new subscribers, I welcome you. I appreciate you. To all my subscribers and light workers that have been with me from the beginning, I love you. I love your continued support and appreciation for what I'm doing. I appreciate you. Share this live with someone, with as many as you can. This is HIV and AIDS awareness. This is Nurse Marie bringing you some education and some support. I did have a few questions and answer, and they're like true and false, and I don't know if whoever knows the truth or who knows and who don't. Um, I'm just bringing awareness. One of my question was, and these are true or false questions. One of my first question was, um, y- you cannot have AIDS without being infected with HIV, and I was asking, is that true or false? You cannot have AIDS without being infected with HIV. Is that true or false? The answer is true. You cannot have AIDS without being infected with HIV. So the true answer is you must first have HIV before AIDS shows up, in a simple term. Number two, once you have HIV virus, once you have HIV, the virus stays in your body for life. Is that true or false? Once you have had HIV, the virus stays in your body for life. Is that true or false? And the answer is true. Once you have HIV, you have it for life. You just have to have medication to maintain your health. That's all you can do. Number three, Does HIV cause AIDS, or does AIDS cause HIV? Tricky question. Does HIV cause AIDS, or does AIDS cause HIV? HIV causes AIDS, not the other way around. AIDS does not cause HIV. You must first have HIV, and then it transmutes into AIDS if it goes untreated. I hope I was able to answer some questions for those who didn't have the understanding of what HIV and AIDS was. I gave you some definitions. I gave you hotlines and phone numbers that you can call if you need help. I was hoping to get some interaction from my audience from this live, but it didn't work out that way. But it's okay. I know how to do a video even if I don't have my audience interacting with me. So until next time, this is Marie's Message 411 TV, and I'm Nurse Marie. Be good to yourself and be good to others. Take care of yourself and be safe. Respect those, respect others, I should say, if you want to be respected. Until next time, this is Marie's Message 411 TV. Nurse Marie saying, have an awesome day. Bye bye.